Okay, so let's get started. Thank you again for joining. This is an Ask Me Anything session for our Nova school in Florida. So I'm lucky enough to have a Nova alum in Dr. Knowlton. I'm also lucky enough to have a director of clinical support in Dr. Ima Damwanyi. My name is Will. I'm an academic and industry relations manager for District 5. I work for Aspen Dental Management, which is the service organization that helps doctors focus clinically on their patients. Anything from supplies. We're the second leading manufacturer or buyer from Henry Schein, second to the U.S. government. Staffing, pretty much whatever you can think of so you can focus on the patients is what Aspen Dental Management is here for you. And I'll let Dr. Knowlton introduce herself and kind of let her know where she's been and her story, and then we'll get to Dr. Ima Damwanyi right after that. So Dr. Knowlton, if you want to go ahead.
Hi, everyone. I'm Dr. Knowlton. If you're from Nova, some of you might know me or have seen me around. I graduated recently in May, right in the beginning of the pandemic, literally. So it's been a very interesting ride from being hired to being to the point where I am now, to seeing just like working in the trenches during this whole pandemic. Very interesting. If you guys have questions about it, I'd be more than happy to answer. I started off as a dental assistant and I went to dental school a little bit later in life when I was in my late 20s, and I've enjoyed every second of it. And you guys are joining a really fun career that you're going to love. And that's all.
Okay. Thank you, Dr. Knowlton. Dr. Ima Damwanyi.
Hi, good evening, and thank you all for joining us. So I'm Dr. Ima Damwanyi, Director of Clinical Support and Charitable Giving for ADMI. And, I joined Aspen about, I'm going into my 5th year. So it's been almost 5 years now that I've been with Aspen. And when I started off with Aspen, I was an MCD, which is a lead dentist in East Peoria, Illinois. Worked with a phenomenal team, had great results, great patient care. And I was actually on the pathway to ownership when the opportunity to be in this role came up. And so I decided, you know what, this is really where I want to be at this point in my career, going beyond the chair and having a greater impact and being able to work with and connect with doctors like yourself. So I took it on and I haven't looked back since. And to be quite frank, that's actually one of the things that drew me to Aspen, because before I was at Aspen, I had taken on different roles in the industry, from an associate doctor to a lead doctor. I had worked in, the creme de la creme traditional private practice, heavy CEREC driven practice, to public health. And I was even a dental director and a residency director for NYU AGD. So I came with a number of years of experience, and along the way, I always felt like I wanted more. But every time I was in a specific role or place, I felt like there was a cap, that I couldn't go beyond where I was then, and I had to seek it out. So it was very, very refreshing to find an organization like this where it's like, what do you want? You want more? We've got it for you. Whether it's within the confines of the 4 walls and you want to be the best associate or the best leader, the lead dentist, or you want to propel your career and be an owner doctor, or you want to go beyond the chair and get involved in charitable giving, which is what I lead, or you want to be in trade magazines, being a clinical expert, like whatever you want to do, be on the board, we will hold your hand, we will support you every step of the way. So I love that about Aspen. The other hat that I wear is leading our charitable giving programs. And it's under what we call the Healthy Mouth Movement, that was initiated in 2014 by our doctors alone. Because what they realized was there was a sect of the American population that just was not receiving or getting access to care, and that was veterans. And that really pulled at the heartstrings of the doctors and the teams. And so we launched the Healthy Mouth Movement program. And through that, we have what's called the Day of Service, where on a Saturday, one time a year, most of the offices will open up and provide free care to the veterans. We've also got the Mouth Mobile that travels all over the United States. It's a hip dental office on wheels, 42-foot long, state-of-the-art technology, providing free care to the veterans. And then we've got our international mission trips where we travel all over the world. We bring on, I lead doctors and teams, and we provide free care to those who really, really need it and have faced challenges getting access to it. So it's been a venture humbling experience, amazing to be able to connect with doctors. And so I'm really excited about this AMA and looking forward to answering a lot of your questions.
Thank you, doctors. So for the students, there is a Q&A function. If you guys, anything pops in your head, we will definitely get to them. They've already started rolling in, so we do appreciate the ones coming in. We'll start with you, Dr. Knowlton. This question just came in. Going back to finishing up dental school, what all options did you have as far as employment or careers? And then what made you decide to join Aspen?
Do they mean like, I guess they're asking like if I was going to go GPR or if I was going to.
Did you have GPR or residency options or
Okay.
private practice options or?
So I interviewed at a couple of places. To me, GPR wasn't the way I wanted to go. I just decided straight out of school that I wanted to start working. I felt confident enough that I knew the dental world a little bit coming from assisting that I could maybe, you know, tackle it. It was definitely still not easy for sure, but it was, I think, the right decision for me because of the way I like to learn. I was ready to stop being handheld, I guess you could say. I was ready to be a little bit more independent and start making my own decisions without having to depend on a professor or something like that. But that doesn't mean that at Aspen, I haven't had the support. I have to say that it's been absolutely overwhelming. How wonderful. Whenever I have a question, someone's always there to ask or text or anything like that. I think it's great. I did have multiple job interviews. Something that I do want to stress for the people who are listening right now is start as early as possible. You are competing against other students that are in the state of Florida. There are 3 schools in the state of Florida, as you know. And also it is still the pandemic out there and there are going to be less jobs, I would assume, for a lot of places. So starting early is very important. And the second thing is being prepared. One thing that I think that made me stick out when I went to go interview was that I had a folder with like my cases that I've done and the RVUs, you guys know what RVUs are at Nova, and all that kind of stuff, the procedures that I've had a chance to look at. And that way you also gear your interview towards questions that you know you can answer because you're showing them cases that you've done. So if they're like, oh, well, what'd you do during this case? You won't be tripped up when you have to answer a question about a denture because you know what you did in that denture. And it always kind of helps that you have that little bit of confidence because they know you're a student at the end of the day, but they know that you came prepared, which means you come for the job.
Thank you,
Well
Dr.
said.
Knowlton.
Yeah.
Well, I'll add on to that. This question didn't come in, but this is a question that we've talked about, Dr. Imadumwani. You've worked in private practice. What are some of the differences, would you say, for people who might want to go into private practice or go work for a DSO? What are some of the differences with your experience?
Well, I'll say that, and I've been a dentist for quite some time. I didn't tell you all that I graduated from USC in 2009, and I did do a GPR. And it wasn't because I wasn't ready or wasn't confident to go into the workplace. It was more so I wanted to, this particular GPR was for special needs. And so I wanted to add that to my scope of care for patients. But after that, I did go into traditional practice. And what I will tell you, and this may be subjective, but I've also talked to other colleagues that have also done the same thing. You know, you're going in and, you know, back then I didn't have any training program. I didn't have anyone who really took me under their wings. Granted, you kind of have this person that's going to be sort of your mentor. You know, if you've got questions, you can always dial them in. They can kind of be your lifeline. But I didn't have this structure in place that says, okay, what we've realized is these are the bare essentials that you need to really help you start to build that confidence, help you start to manage your chair better, manage your schedule better, be able to communicate more effectively with your patients and build that trust with them. I didn't have that. It was kind of like, well, watch me do it and then you do it, you know, and it wasn't very interactive. And I had to learn the hard way too, because when I went into practice, I was in a practice where there were 2 other doctors. So it was kind of like feast or famine. And these doctors were not about to break it down for me or share their best practices or knowledge because we were on a production or a percentage of collection. So that made it difficult too. So it's very, very competitive. And what I'll say in being in a DSO is that there's this hub of shared knowledge. You know, in our organization, we've got over 1,200 doctors. And yeah, there's some competition, but it's healthy competition because everyone's trying to build each other up and support each other. And it's like, yo, what I know, I definitely want to share it with you because that's only going to help build our, strengthen and enhance our patient care, but it's also going to build the brand too. And we all represent this brand. So we all want to make sure we have our best foot forward and we're helping each other out. So that's one of the differences that I noticed over the years between being in traditional private practice and being in DSO. The other thing too is opportunity. And I alluded to this earlier, because when I was in traditional private practice, when I came in as an associate, I could only be an associate because there was a doctor already there who was the lead doctor and the owner doctor. So if I wanted to be more, either I had to like buy him out and hopefully he would retire in a year, which was not going to happen. He was going to retire in like 15, 20 years, or I had to seek opportunity elsewhere. And I don't know about you all, but I like to be in a place and feel like in that place, I've got a wealth of experience, a wealth of opportunity, a wealth of resources, and I can maneuver through that space. And I don't necessarily have to go bounce from one job to another. And I think in my generation, that happened a lot. We were bouncing, we would stay in one place for a year or 2 years, and then we wanted more because of earning potential or because of opportunity and growth, and we go somewhere else. Where in a DSO, and of course I'm going to be biased because it's Aspen, it's a one-stop shop. You want to be an associate, you want to go to a lead dentist, there's an opportunity. You want to be an owner, there's an opportunity. And the other piece to it is there is a doctor development journey for you. When you come in, you're not just going in and being thrown into the lion's den like I was. You're coming in and there's a plan. There's a structure in place. There are programs, there's CE courses, there's touch points throughout your career that are really going to help you excel as a clinician and as a leader and really understanding the business as well. So those are some things that I would say are for me are different from traditional private practice and progressive private practice, which is what I call our Aspen offices.
That's good. That's good for me. Good knowledge for me because yeah, that's awesome. The differences there. So thank you for that. Dr. Knowlton, she mentioned that the doctor development journey. I know you just started in May, but have you got to experience any of that with COVID going on?
It's been a little different with COVID going on. With COVID going on, a lot of the fun stuff that you get to do at Aspen has kind of been put on hold. They've done a lot of virtual versions of it though. I've gotten to do Invisalign online, the course for Invisalign. I've gotten to do implant training online as well. I just finished that. I haven't gotten to do the lead yet, the vibe thing yet online, but it's because we're so busy. I'm a stutter at words. I've done so many things in the past.
Aww.
6 months? I've placed an implant in the past 6 months.
Yay!
Like absolutely insane. I've probably prepped more crowns than I've seen in the past, even including practicing for boards in past on a day that endo is in the room, we probably prep over 20 crowns in a day, at least just by myself. So you're definitely going to get the experience. I just wanted to add really quick to what she said, which was she's incredible. But she was mentioning that in private practice, she was kind of pigeonholed, I guess you could say, with like something to do. I have friends who are in private practice, by the way, and they feel the same. They kind of dictate the work that they hand to you. Versus at Aspen, whenever Dr. Gillen, who I work with, would see, I'd be like, oh, I'm so uncomfortable with extractions, for example. He's like, well, guess what you're doing today? All extractions, all the extractions that come through the door, you're going to do it. And I'm going to be right here with you. And he would walk right in and he'd see how I'm doing my technique. And he's not over my shoulder. He would just watch, tell me, why don't you try this next time? He's not sitting there like watching you, criticizing you. He's helping you, which is something great. You don't feel that pressure of, am I doing it right? Because he's always there. And it was the same for anything. Oh, today I haven't done many crowns in dental school. Don't worry. Well, today you're going to do all the crowns, It was like that. As opposed to, I will say a lot of my friends in private practice are saying, I've been doing mostly fills because they don't have anything else for me to do. And that kind of stinks. So I've been happy.
Thank you. And we hear that a lot. So it's good to hear from somebody who just started recently. This question just came in for Dr. Knowlton. Can you please describe your compensation as a recent grad / associate dentist?
Yes. So the compensation the compensation works. You get a daily rate, a guaranteed daily rate, no matter what. Even for example, on Fridays, we work 8 to 1. We still get a full day of rate. It's not like they give you only a half day. And also on Saturdays, you work 1 Saturday a month and you'll actually get overtime. So you'll get 6 days worth of, even though you're only working, I think from 8 to 3 or something like that, depending on whatever it is. So half days are still paid for full days. Extra days are paid for. So you get off, and then you get a percentage at the end of every, not the end of every month, you get a bonus every month if you meet the, I believe it's the budget. I think that's what it's called. And then from there, you get extra. So that's exciting. It's been really good so far. Our office is very busy, so I cannot complain about how well we've been paid. I have to say it's been good. Honestly, it's been good.
Okay, that's a good answer.
No, they want one other small detail. It does depend on the region that you go to, is how much you're going to get stated. I know friends of mine who are in Aspen in North Carolina who get paid differently than what I do. And even people who have gone to maybe rural areas, they get paid differently from I do. But one thing that will always be the same is the 8%, which is what you get as an associate, and the 16% is what you get as the MCD, I believe.
And to add to that too, it is going to be contingent on your region. So, and those are the conversations that you can have with, if it's a practice owner, or, you know, if it's a director or whatnot, you can talk about what that earning potential is going to look like, and they can break that down for you and let you know. But there is going to be a percentage of profitability aside from that daily draw that you're going to get. There's going to be gross profit, and from that, there's a percentage that you're going to be eligible for profitability. So if that time comes, you can have those conversations and negotiate or whatnot.
Definitely. I think the one thing that everybody always worries about, and you hear a lot as a dental student, is will I have to give my money back or my paycheck back if I don't meet a certain quota? And that's not the way it works at Aspen. You get paid that daily rate no matter what. And I think that's something that a lot of the people who I went to school with only got that daily rate up to a certain amount of months. For example, they'll only pay them for 6 months that amount. And then after that, it's on them, whatever production they can come up with. And that's the way it works here. You will always get that. So if you have a bad day at work and it just new patients didn't come in, you still get that amount that you were promised no matter what. So you're never going to pay anything back or get penalized for not meeting a certain amount.
And if I could just add one more thing to that, it's not just the way it works too, is it's not just the onus is on the doctor. It's really focused on the team and to really collaborate together. Because the focus is always going to be, number one, patient experience, but team experience as well. So where that's different is that, you know, in other places, it may be based on percentage of production, whatever you produce, or percentage of collection, whatever. And you hope that your business team is collecting and, you know, placing those deposits. So that's one thing that I think really stood out for me when I joined Aspen, is I didn't feel this pressure like, okay, I've got to produce. And then you may get into a situation where, are you really doing it for the best interest of the patient? Or are you doing it for the best interest for your pocketbook? So we take that completely out, that friction completely out of the system, because we want doctors to focus on the dentistry, do right by the patients, do right by the team, and then the rest will follow.
Yeah, I was going to ask you, what was that based on? So you hit the nail on the head, Doctor. I appreciate that. Dr. Knowlton, you mentioned Endo Day. What did you mean by Endo Day?
So I call it Endo Day. I'm not sure if that's a real term, but I call it Endo Day. It means we have specialists that come in on certain days. For example, the oral surgeon and the endodontist who comes in on certain days of the week. And usually what I call Endo Day, we do a lot of crowns because it goes straight from the endo chair to our chair to do the crown prep for the root canal that just got done. So it's when the endodontist comes in, the day that he comes in that week. He comes in, like, for us, at least 2 or 3 times a month.
Yeah, I wanted you to hit on the specialists that we have in some of the practices. And Dr. Imawanyị, does the specialist production, does that factor into the profit sharing that we mentioned earlier?
That's going to be separate. So when it all, at the end of the day, there's going to be some tabulations, right? So you're going to have to account for what it costs to keep the lights on, what it costs to make sure that you have the instrument supplies and things like that, and the other controllables, right? Or the other fixed costs. And then the specialty. So the specialty will have their own piece to it too, where it's negotiated how much they're going to take in terms of their production, how much goes to the office, how much goes to them. And then after that's all said and done, again, there's going to be that gross profit. And from there, you're going to be eligible for your percentage of profitability, aside from the daily draw that you get. And the other thing I wanted to add to that is most of the offices will have a specialist. Now, they may not have both, but a lot of times they'll have the oral surgeon or they'll have the endodontist. And really what it comes down to is, having them available in those areas. But I will tell you, there's a strong focus across Aspen Nation to ensure that we are, hiring as many specialists as we can, because we know that accessibility, convenience for the patients, and really supporting the doctors in that light is going to be the most fruitful. So there is a strong initiative around that, and we've got a lot of specialists, a lot of endodontists, a lot of oral surgeons. We've even got a few prosthodontists. Our senior vice president of our implant support is a prosthodontist. We've got a couple of orthodontists and periodontists. So we've got a large network of doctors and specialists.
I just wanted to add, if you don't mind, if there was another quick question. I just wanted to say, I still do oral surgery and endodontist. I still do root canals. I still extract teeth, even though we have those specialty come in. When you start to work, and this is for a lot of the students, they probably have questions like, oh, will I ever get to do an endo again? The answer is yes, you will get to do an endo. But when you start to work in the real world, you cannot spend realistically 4 hours like you did in school on a root canal, or 4 hours like you did in school on an extraction. And you don't want to, because then you'll get backed up. You do have patients waiting on you. You do have new patients you need to see. You do have denture adjustments you need to do. So there will become a moment when you're like starting to think, is it worth me sitting in the chair today and doing this extraction when the oral surgeon could do it quickly, efficiently, and I could see and help 3 other patients in the time it would have taken me to do this extraction. So at that point, you start thinking more like a doctor, more like a business owner, and more like a clinician that's trying to help the most amount of people in a day. So you do make that active decision. Okay, I'm going to use my specialist for this because it's the smart thing to do. But today I did 2 root canals on number 7 and number 10. Crown prepped them for a bridge, and I've gotten quick from May to now. I can do that within an hour, maybe an hour and 15 minutes. I know it's crazy. I know some people know me who's on here. Shout out to everybody that I know. And I know they're thinking to themselves, there's no way. No, honestly, you can do it.
Yeah, you can do it.
That's the difference.
That's
awesome. Do it.
I love that. We'll go with stick with Dr. Knowlton for this, but also want your input, Dr. Imo Ndamwonyi. This question just came in. What would you say is the clinical autonomy like as an associate versus the practice owner?
What does that mean? What would we say? Meaning?
Like your clinical autonomy as, let's just say, as an associate. What is it like to have that ownership and power of your own clinical autonomy?
Okay, so at first it was, you do have a mentor, so you become sometimes a little bit dependent on your mentor when you're trying to do treatment planning. I think that's what you're asking me, like, do I get to make my own choices when it comes to what I want to do, what's best for my patient? The answer is 100% yes, but the answer is also you're not going to have the full confidence when you first start. You're going to always question, is this the right thing to do? Should I extract this? Should this be a root canal? So you will depend a lot on, your higher up doctor asking questions and things like that. And they'll always turn to you and say, what do you think? What would you do? What would you do if this was your family member? What would you do in this kind of situation? And in that kind of sense, they kind of push you to be the doctor that you want to be. But I do always make my own choices when it comes to that kind of stuff. I always try and think, okay, what would I do if this was my mom? What would I do if this was my dad? And if that is the correct answer, then that is what you go with. No one's ever going to tell you, no, you can't do that. That's not going to make the most amount of money for the office. No, if you think it's right, if you think it's the decision that should be done, then you go and you tell it, because you can't tell a patient wholeheartedly what to do if it's not coming from you or from your heart. You want it to be sincere, and it can't be if someone's telling you what to do. So that's something that I think that I haven't felt pushed about,
Anything to add, Dr. Imadamoni?
I think Dr. Knowlton, I think you said it very, very well. And I can say that emphatically, that there's never going to be someone who's going to be over your shoulder saying that or criticizing you and saying, no, you should do it this way, you should do it that way. The reality is no two doctors are going to think alike, right?
Right.
And they're going to come with different perspectives. And in our organization, we've got doctors that literally represent every single dental school. So you know what that means? 67 dental schools, 67 different ways to do different things and have different styles and approach. And that's the beauty of it is while you have the autonomy, you also have this very enriched experience of learning with other doctors and sharing those best practices and sharing those different perspectives. And through that, really establishing what is your preferred practice. And I think as an associate, that's one thing that, you know, I would strongly encourage as you're coming out and you're in the workplace, wherever you decide to go, is really start to hone in on what do I believe in now, right? Because you're going to have all these principles that are laid down for you. They're going to be presented to you and you're going to be like, this is the indication for this. This is the indication for that. This is the technique for this. This is the technique for that. But when you come out, you know, and you start having these real world experiences and stuff, and, you know, interacting with other colleagues, and hopefully you're working with alongside other doctors, you get to learn different, you know, different things and different best practices, like I said, techniques. And I think being humble and being open to it will only further help you grow as a clinician. And I love how excited Dr. Knowlton is when she talks about, you know, she came in May and look how far she's grown, look how far she's come, and the confidence, and you speak with a lot of confidence. And I think that speaks a lot to your character, but also to your experience, the experience that you've had thus far, and just shows like you have a mentor that has your back. All they want is for you to be the best clinician and to realize your greater potential. I think that really is what it should come down to. And you should still feel like whatever you believe in is what you're gonna own, and you're gonna present that to the patient and you're gonna stand by it. And you just have people that are gonna help you along the way. That's really all it comes down to.
Definitely.
Awesome. Thank you, guys. This question just came in. I'm graduating this year, and we've talked about it a little bit, but mentorship is extremely important to me. What does the onboarding and training process look like for new hires first month or two on the job? And I'll let either of you guys take that. Both of you guys probably have some input on that.
Yeah, I could talk about what programs we have available to the doctors. And so right away, like I said, when you come into our organization, you're not going to be thrown into a lion's den. We want you to come in and understand who we are, first of all, you know, what our culture is, why we do what we do, who our patient base is, because the more you have an understanding of our patient demographic, the better you'll be able to serve them, right? And to have that sense of urgency around their care and compassion for them and provide that scope of care for them. So when you come in, we have what's called Discover Aspen. You'll be a part of that for 3 days before you actually start your onboarding in the office. And what that entails, because right now we're virtual, and while we would love to have it face-to-face where, you know, typically in the past we would fly the doctors up to Chicago. We have this huge learning and development center, state-of-the-art technology, get to interact with your peers. And we talk about this piece of it. You get to meet Bob, the CEO, Dr. Judge, the CCO, other members of the executive team. We talk about the culture piece. We talk about the doctor development opportunities. There's CE courses sprinkled in there to talk about treatment planning and case presentation, really help you build your confidence as you start your career with us. And then after Discover Aspen, you'll go into what's called the Doctor Development Program. So that's a 4-week training where you'll partner up with a mentor doctor. So in Dr. Knowlton's case, her mentor is Dr. Gillen. They're there with you chairside, shoulder to shoulder. They're taking you under their wings. And they're working with you on how to manage procedures, how to do them and complete them effectively in a time-efficient manner, how to gain confidence in your treatment plan, establishing a best option for the patient, managing that experience, building trust with them, really finessing your chairside manner, running your particular chair, and then now being flexible to run multiple chairs and be time efficient with that. And as you continue to grow in those 4 weeks, they're building upon your schedule to helping you hone in on those skills. And the key here is really build that confidence and really get good at doing procedures, whether it's extractions or root canals or crowns and things like that. Then by week 6, you have the opportunity to join what's called Beyond the Chair. And that's really where you get to master your role. So as an associate, again, expanding your scope of abilities. So really diving into, oral surgery techniques or endo or Invisalign. So we've got ortho programs. So incorporating that into your, scope of care. And before that, I forgot to mention this, we also have our implant continuum. So by day 3 of your Discover Aspen, you have the opportunity to now join the implant continuum part 1 and 2, where you get immersed in, diagnosis, treatment planning, case presentation for implants, getting confident, restoring implants, restoring overdentures, and denture or implants with overdentures and things like that. And that continues to build by week 6. And then in Beyond the Chair, you're building upon that knowledge. So how to run your schedule more efficiently, optimize it, dentures and how to troubleshoot through that, best techniques to get more predictable results. The business aspect of it, really strengthening that business acumen, and leadership. So there's 3 pillars. There's a clinical focus. So there's a lot of CE sprinkled in that. There's webinars and podcasts. There's a leadership piece. And then there's the business management piece. And you still, even through that, because that's in the first 3 months, that's 12 weeks, right? But even through that, you still have these touch points along your doctor development journey where you're continuing to master your role and then focus really on how to be even better as a clinician, both within the chair and within the 4 walls. So if there's doctors who are like, I want to be part of trade magazines, I want to be an expert at that, or I want to be on a dental board, how do we get me there? There's programs in place from a leadership standpoint to ensure that the doctors have those opportunities.
I think you answered that question in full. And here's a follow-up question for you, Dr. Knowlton. She mentioned that you have the mentorship for the first 4 to 6 weeks. Once you got your schedule and it was kind of a full associate schedule, what did your day look like? Like how many patients, what types of procedures, how did, multitasking, just kind of go over what your day looks like now that you have a full open schedule.
So I see definitely a full range of procedures in a day. You have a whole column just with denture adjustments and denture deliveries, and that's called your overflow column. That's kind of your, emergencies, dentures and all that stuff. And then you have your production column, which are going to be your crown preps, your root canals if you're going to do them, your extractions if you're going to do them. Also in the overflow, you have your impressions if people are coming in to get dentures and impressions. And then you have your new patient column. So you can imagine you're running about 3 columns. You have a lot more assistants in the actual working world. You have your assistants who are helping you out with denture adjustments. So it's not like you're overwhelming yourself at any point. You still can sit in your chair and spend your time. I don't think I ever would say that I cut my patients short at any moment, and we're pretty busy, but I still sit in my chair, ask them how their day was, get to know them, everything about, I would never say I'm rushed at any moment, but you do have a little bit more, sense of urgency when you start getting into the real world, because you are running those 3 columns. So for example, let's start with what my day would be. If I have in the morning at 8 o'clock in the morning, a crown prep, I numb up that patient, go and see my denture adjustment while my assistant is taking, while my assistant is taking x-rays for the new patient. So once I'm done with that adjustment, I go back, I start on my crown prep. If I'm at a stopping point, I can go then to my new patient and say, hi, how are you doing? Discuss their treatment options, look through their x-rays with them, and then hop right back into finishing up my crown prep and taking my impressions. And by then kind of start that whole cycle back over again, have the next production coming in, have my next, new patient coming. You find ways to kind of go around, if the patient is waiting on you, always have somebody in the room with them, kind of keeping them entertained, so that they never feel like they waited too long for you. And of course, if they do, you just apologize. They're pretty understanding about it, but you are definitely on roller skates, but not in a sense that you feel overwhelmed, just in a sense that you feel busy enough the day goes by fast. So that's good.
And at what point did you feel comfortable with that schedule?
That's a good question. I mean, probably I'd say about the 3 months that it took through all that, that comfortably say about the 3 months.
Mm-hmm.
Right now, I'm at the point where I feel definitely comfortable. Like I know for a fact if you put 2 crown preps next to each other on the same time and still got all those columns filmed, I could probably find some way to still get through it and run maybe 15 minutes behind, if that.
That's awesome.
And that's the key too, is just being mindful and being prepared for the schedule. And we talk about, like, and this is something that we don't do in dental school because they don't teach us this, but like huddle, reviewing your schedule before you even walk through the office, so you know what's going on. And then, in the morning, getting together with the team and talking through that, and just talking through how are we going to maneuver through it. And then over time, it's like you find where there are those opportune moments for you to break away. And that's one thing that you do have to learn when you come out of dental school, is breakaway points. Because in dental school, you're running through 3 hours, and the only time you have a breakaway, and it's really a breakaway for the patient because they're probably like, oh my gosh, finally they let me relax my jaw, is because you need a checkpoint from your faculty. That's like the only breakaway point. So, but in the office, you have to find those times, those areas. And when you're in your DDP program, your mentor doctor is going to help guide you through that, to where you now start to develop that confidence that Dr. Knowlton said, where she's like, okay, now I'm strategic. I know that at this point I've got to break away so that I can bounce over to this patient, make sure I can do this, I can talk to this new patient, and then continue that flow. But that comes with time. So I never want people to feel like daunted or like, oh my gosh, like, will I ever get there? You will 100% get there. It does take time. It takes guidance.
For sure. You're going to spend, in the beginning, you're going to spend 45 minutes just polishing a composite. And then at some point you're going to realize, okay, put the drill down. You did a good job. Let's just go. You really will.
You both brought up the schedules and the huddle, reviewing the schedule. How does your schedule get made, or who's responsible for the schedule? And
Dr. Knowlton, you want to take this one because this is fresh for you? I'll reference like how it was for me in practice as well.
Definitely, it's both. So when you, for example, if you have a patient that comes in for a crown prep, the delivery is obviously going to be next. You're scheduling that delivery. So together with your dental assistant, you guys look through the days, look to see how long the crown takes to get back, and you pick a date. So you're kind of already starting to manipulate your own schedule once you're seeing these patients. Same thing as if you took the impression today, the next is going to be the wax bite. You look through your schedule. I always am mindful with my schedule. For example, on a day that I know that I'm overwhelmed, I'm going to be like, well, we're going to put them for the next day then, because I'm not going to see 13 denture adjustments when the next day I don't have as many. Sometimes you do have add-ons from the upfront desk. You just kind of learn to deal with those kinds of things. But also, if you're there early in the morning, you can have the patients called and tell them, listen, we're running a little bit behind, and could you come in a little later? Or we're running, we had some people cancel. Could you come in a little earlier? You're always in constant control of it. But it's also a dual responsibility. Your upfront desk does take a lot of it, but you also take a lot of it too. There is always an opportunity. You'll always have your hand in it. In other words, you'll never not. You shouldn't have too many surprises if you're very aware of what's going on in the office, which you absolutely should be, because as the doctor, you're the one seeing these patients and you should always know what to expect. And that's something that I think my mentor is wonderful at telling me. He sits every morning and looks through that schedule. And even by mid-afternoon, he looks to see, did anything get added on? Did anything get taken off? He knows everything that's going on. And you have to learn to do that on top of you will be wearing many, many hats. And that's one of them, checking out your schedule, making sure that you're good, making sure that you're not overwhelmed, but at the same time, making sure that everybody's coming in when they're supposed to and stuff like that.
And the other piece to that too, and what Dr. Knowlton just spoke on, is what we call auditing the schedule. And it's a best practice. It's not like an Aspen way. And a lot of the things that we're talking about here, it's not an Aspen way. These are really literally tools and resources, best practice that are going to help you be successful, right, in the office. And so with that, with the schedule pieces, we've got some tools like a clinician preference guide. When you come into the DDP or the training program, by that second week, after you've started to gain your footing, you're getting used to doing procedures and working that chair, you've got your mentor by your side, they'll look through the clinician preference guide. And from there, that's your voice. That's where you can indicate, okay, this is how much time I need for this procedure. If it's a crown, or if it's, your denture adjustment, or your single canal, root canal, or your fillings, if you're doing quadrant dentistry, or if you're doing 2 teeth at a time, you can start to establish that and put some time preferences so that your business team knows and understands, okay, this is how doctor likes their schedule, and this is how much time they're going to need. And so they can keep to that. And then over time, you're going to update it, because as you start to gain that confidence and you start to become more time efficient, the time preferences are going to change. And so you'll need to, talk to your team members about that so that they're aware and they're right there with you as you continue to grow. And just know that, there is that tool, and really having those conversations with the team member, having the conversation with the mentor doctor or the owner doctor about, the schedule piece. Because when you come in as an associate, the idea is that you are working your chair, because we want you to be comfortable. We want you to be confident with doing procedures and doing a breadth of procedures. And that's the other piece that's different from traditional private practice oftentimes, is that you may be in a chair and doing a ton of composites. I don't know of any associates right now in our organization that are just doing a ton of composites. Really, it's what they want to do. So if you want to do extractions and endo and all of this other stuff, which most associates are like, I just want to be good at everything because I'm a general dentist, then we're going to make sure that we're helping you build a schedule that meets that, need that you have. But then you're also pushing yourself. Dr. Knowlton alluded to this too. You're pushing yourself to be more effective with completing those procedures and doing it in a timely manner, and still having wiggle room to now go help out in an overflow and help out with a denture step, or help out with a new patient or whatnot, because that's only going to help you develop those skills and, again, grow as a clinician.
Yeah, I think you guys, that was a great answer by both you guys. This is a follow-up that just came in. Is all scheduling done by the front office, or is there an Aspen Central location that may add patients to your schedule?
Good question. So when it comes to procedures, that's going to be taken care of within the office. Okay. So, and I'm talking any type of procedures, whether it's hygiene, whether it's your procedures, restorative, dentures, specialty, you own that piece of the schedule. The piece of the schedule where there's a call center that's involved is our new patients. And it makes total sense because we have a very strong patient demand across Aspen Nation. And the reason why is because we know our patient demographic, and we know that they're going to come with a wealth of need. And oftentimes they're going to have doors shut to them. They're going to have places that tell them it's only fee for service. We don't accept their insurance. There's a lot of no's. And so they're beating down the door trying to get into our offices. They're conveniently located. The hours of operation are convenient for them. We're a one-stop shop in so many of our offices. And so we do need a centralized area. And we've got 2 call centers, one in Arizona, Chandler, Arizona, and Syracuse, that really help us to manage that. So what they're going to do is they're going to get that patient appointed. And the idea is to get them appointed as soon as possible, because as consumers, when we want something, we want it now. So a lot of our patients, they're going to come, their denture broke. They don't have a denture. They're in a lot of pain. It's been, on average, our patients, I think it's been about 10, 15 years since they last saw a dentist. So you can imagine they're going to have a lot of dental needs and issues and concerns. And so the call center is charged with getting those patients in as soon as possible into the offices. And the rest of it is up to the doctor and the team to ensure that they are getting that access to care.
Yep, and that's a good question, or good answer. Dr. Knowlton, anything to add?
No, there is one other call center that is fun that I've used quite a few times. That's the emergency call center. So whenever you have a patient that, for example, I get a lot of, patient is calling, they're in pain. They just saw you a couple of days ago. They're wondering how you can help them out. The wonderful thing that I've learned about it is you can text the call center back. They send you a text to your phone and they tell you patient so-and-so is in pain, and they give you the patient's phone number. And for example, the other day I left the office without approving prescriptions, and they texted me, oh, this patient didn't get their prescriptions in the pharmacy. And I forgot. The honest truth is I forgot what prescription it was. I didn't remember what it was for. So I texted back the call center, can you ask the patient are they allergic to penicillin? Because I knew it was an antibiotic. And they answered me right back. No, the patient said they were not allergic to penicillin. I said, okay, perfect, no problem. And I went and I called the pharmacy, and they even give you the pharmacy number that they're asking for, and you get to just call them and give them the prescription straight through. They're absolutely great. That's another really, and that's a good support that Aspen gives you. You don't have to sit there and get phone calls at 9 o'clock at night from a patient, you know, asking you, where's my pain meds? You know, the call center very nicely texts you, hey, patient so-and-so wants to know, you know, they're in pain. Can you send them some medication? And you just text them right back, yes, tell the patient I'll send it to them right away. And they usually just get in contact with the patient for you. And all you have to do is just call up that pharmacy and get them the information that they need. So it's great how that's handled.
One thing I did want to add, going back to the call center and the new patients, is just to kind of put things in context. The average number of new patients that are in an Aspen office is about 6. And so even though, again, these patients are beating down the door, a lot of times they just want to get in, and a lot of these offices will have a higher demand. There's ways to manage that. And there's ways to look at, there's something called like a magic report that can really hone in on, you know, the number of new patients, the number of calls that are coming into the office, just to make sure that that flow is managed well, and the doctor feels good about the number of new patients and being able to manage that effectively along with the rest of their schedule.
Awesome. This is kind of a follow-up question that just came in. What, Dr. Knowlton, we'll start with you. What has been the biggest support that Aspen Dental Management has provided with you in this short period of time you've been with us?
I've been so lucky in my mentor doctor, Dr. Gillen, that he has had my back in absolutely everything. And as I feel like he's completely taken me under his wing, he's shown me a little bit of everything. He's been such an amazing support, but also your office manager is wonderful. Like, she's always telling me how much she supports me in any decision that I make. She comes back to me, she goes, how much time do you need for something? Or, you know, I put this person on your schedule, are you going to be okay with that? That's another good support system. There's a lot of working pieces that work in an Aspen office. You have your assistants, you have your front desk, you have your treatment plan coordinator, which is another amazing support. So that's one of my other favorite supports, the treatment plan coordinator, I think the TPC is what they call them. And when you go over treatment with a patient, they basically go over the not fun stuff, which is the money aspect of it. And they help a patient. You guys work together hand in hand. They are your support team. They are the ones that help these patients get the care that they need. You're telling a patient, this is what you need to be healthy. And that person comes behind you and tells them, this is how we can get you financially ready to get you healthy. And that's such a big support system in Aspen. And it's such an important role that you play as a doctor, that you have someone helping you out with, because you don't have to sit there and go over financials with a patient for another hour in the chair, because you're just trying to focus on what's best for their needs to get them where they need to be. Another great support system that we have are my assistants. My assistants are my everything. We are such a family. If you ever see my posts on Instagram, some of you guys are my friends on Instagram, you see me constantly posting like all the parties that we have every month, and, you know, the potlucks and our birthday celebrations. And we have such an amazing team, and it's so great that you build this with, you come in as a new doctor and they automatically treat you with such respect and such, you know, love, because they know you're new and they have such patience with you. I remember I would sit there and I'd tell my assistant, I'm so sorry. I would apologize to them because I was taking so long on a crown prep. I'm like, I'm so sorry, I'm taking so long on this. And can you please hand me this? She goes, don't worry about it. I got you. We know you're new. We've done this before. We get how it goes here. Never did I ever have a comment back going, I know you're really taking a long time in lunch. You know, like they will sit there. My assistants will stay with me we'll have lunch at 1 o'clock or whatever. They'll stay with me till 1:30. They'll stay with me till 6 o'clock, 7 o'clock if I took too long on something, and will always have my back. Will always sit there and help me clean. It's great. I have nothing but support all around me all the time. And if I ever need something outside of the office, you also have regional managers that will come in and support you. It's endless. It feels like it's endless. There's something for someone for something is what I meant to say, for everything in Aspen.
Literally, for every doctor, for every individual at Aspen, there's hundreds of people that are working for that individual to help them be successful, help make sure that they truly feel supported, they've got what they need. So, you know, Dr. Knowlton referenced her office and the office culture and just the network of support within that, right? And it's a family. And we want everyone to feel like it's a family throughout. And to know that even beyond the office, there's a vast network of support. I alluded to the call center. We've got, our practice support center, and we call it the centers of excellence, where, there's training and development, there's HR, there's legal, there's risk management, all the things that you don't even fathom when you're in dental school. Then you come out and you're like, wait a minute, who's actually doing payroll? What about insurance benefits? What about, if I have an issue that comes up, how do I manage that? What are the risks involved? What are the legalities? Or just understanding, how do I get more involved in my community? How can they help, provide that support for me? Or how can I excel my career beyond where I'm at right now? Or I want to go into ownership. How do we get me there? There are all these different programs, all these different silos that our role is to ensure that you're getting what you need as a doctor. So it does go beyond the office. And when you feel that effect in the office, you can only imagine how that feels beyond that point. And that's really the culture that we have. So I love Dr. Knowlton, you're like, exuberant about your experience. And this is the Aspen culture. What she has shared with you, this is the true Aspen culture, and you can't fake it, at all. And I feel like, Dr. Knowlton, you keep it real. You're not going to sugarcoat it.
Seriously, the other day I asked for a calendar because I wanted to start posting the birthdays on a calendar. And I went to Target and she gave me money to go to Target. Like, it's just, the office manager did. It's down to the little things. She talks about these big, beautiful things, and she's right. They do cover you on all those aspects, but it even goes down to the tiny things. Like, if I like pink gloves instead of blue gloves, my assistants are looking through the Henry Schein book, finding me pink gloves. And you develop a family for sure. You're there more than you see your own family sometimes. And it's nice when you can work with people that you love, and we all love each other very much.
Well, you mentioned blue gloves, pink gloves. This question came in earlier. We just got to it. Do you have a say in what equipment and supplies you use in your office?
You do, but you have to also think about it through a business aspect of it, which is something that I definitely have to keep in mind. You can have pink gloves, but at the end of the day, is it worth the extra, however much money it is, when you're trying to think about your budget? And that's keeping it real. You have a budget that you have to stay under, and you want to stay under it because obviously you get bonus off of that. And you also, look better as profit when it comes off of that. Like, yes, I can buy the pink gloves, but can I wear purple gloves? Yes. And, without having to pay those extra $10 per box, it's fine. I got them for a month and I love them, but I'm fine with the blue after I got my fix with the pink. So, but yeah, you do want to, you're something that you don't have to deal with in dental school. Yes, this is what I meant to say, was that you don't have to worry about a budget. And though no one's pushing you too much to be on that budget, you want to put yourself in check, because everyone gets affected by it, and especially you are working your butt off, and you do want that. The truth is, you do want that bonus check at the end of the month. And how you're going to do that is keeping your eye on the budget, keeping your eye on your schedule, keeping your eye on the money coming in and out of the office. And that's something that my mentor has been very good with teaching me. He's like, you always got to be paid. You always got to see, is there a patient that hasn't been scheduled for an impression this month that could have been, because that's income coming into the office. And you are now wearing that hat where it is your problem now, what is coming into the office and what's getting scheduled. It's important. So you learn, but you do have someone to show you that. And you do have people who will be willing to sit with you to show you how to do that, so that you can always get the max amount of the schedule and the bonus and the budget. So yeah.
Okay, great. And like I said, I mentioned earlier, Henry Schein, like we have a good price on most of our supplies because we do use Henry Schein second only to the US government. So, if there is a certain thing you need, there's a chance that we can get it for you, and it would come at a good price. So,
yeah. And we have a robust formulary too. So, this is another difference from traditional private practice, is that it's going to be limited in terms of what you're going to have access to because of the cost. And so being able to negotiate those fees and have a strong buying power that we have with a lot of our vendors allows us to not only reduce the cost of what it would, what it would be to have these supplies and the equipment, which means it's going to drive down the costs in the offices as well. But it makes it so that it's more affordable for the patient. So for us, it's a win-win. Doctors are happy, right, because they have lower costs, and the patients are happy because now they have more affordable, accessible care. Because we know of practices that they'll drive up the cost, like what happened with COVID. We had to take on all these additional armamentarium to ensure that we were keeping the team safe, keeping the patients safe. And we made a decision that we weren't going to hike up prices like a lot of other companies and organizations and practices did. We weren't going to do that because we wanted to do what was right for the patients. They shouldn't be penalized for it, and we'll work through it. And we have, and we've been very, very successful over these last several months of being in this pandemic because we did things the right way, and we were very business oriented, yes, but very people driven and focused.
Yeah, I think you said that way better than I did. Good job. And this kind of goes into the supplies and equipment, but what kind of technology do Aspen practices have that maybe some offices don't, i.e. CERAC, CBCT, iTero, things like that?
Well, we have iTero in, and this is just being able to use digital scanning technology because we listen to the doctors. We always have these ongoing doctor focus groups where we'll get a collection of doctors or a group of doctors and have them share with us what they feel would allow them to be able to do dentistry easily, be more effective, to have more predictable results and things like that. And in considering that, we're in this wave of technology right now, right, in the industry, and we're right there in that wave as an organization. So we've got CBCT. The idea is that we want to have it in every one of our offices. We do have it in so many of our offices. With iTero, we've got that in, I think, I want to say over 500 or more of the offices, maybe 600 now, because we're about 849 offices strong, I believe, at this point. And so that's the idea. The other piece to it too, as we look into digital scanning and making sure that we make available to the doctors training on clear aligners, training on the restorative piece, how to really utilize that, not just from clear aligners and education, as another visual aid for the patients, but also from a treatment planning standpoint, from a restorative standpoint, being able to scan for impressions and stuff like that, send it off to the lab and have a quick turnaround and have more success with those cases. So we've gotten great feedback from the doctors around that. Obviously with with implants, the use of the CBCT as well, 3D imaging. We're looking into artificial intelligence. Right now, we've got some pilot programs going on in some of our regions with voice activated periodontal charting to make it much easier for hygienists to go in and just start calling out numbers, and it's automatically being inputted. We're also looking into AI for diagnostic purposes, just to make sure we're increasing the, not just the diagnosis, but we're increasing the ability for doctors to really make the most definitive diagnosis when it comes to reviewing the radiographs and other imaging. So we're looking into that. We're also looking into digital dentures as well. So that's been really, really exciting. We've got a focus group right now, or a pilot group that's doing that, I believe, in New York, and we're getting great feedback from them. And the reality is we, as an organization, the focus is to invest in the doctors, invest in the people, and to invest in them growing their clinical excellence, right? So by us doing that, we want to make sure that we're ahead of, any advancements that are taking place. And to be quite frank, a lot of these companies come to us because we are the largest DSO, because we have so many doctors in our network. They're coming to us and saying, hey, we've got this on the market, we've got that. And sometimes they'll come to us before they go to the rest of the public to ask us what our opinions are on some of these modalities or technology and stuff. So it's really cool to be at the forefront or the top of the mind for a lot of these companies and be involved in that and incorporate that into our care.
Yeah, that's awesome. That's exactly what I wanted to hear. We got one last question, and then I always like to ask a personal favorite of mine, and we'll be done. That hour flew by. I appreciate all the questions that came in.
Did it
Are there
already?
any?
Oh my goodness.
Yeah. Are there
Wow.
any? Are there any CE courses that are required or encouraged? If we decide to participate in one, are there stipends?
I know that the implant one, they told me and the Invisalign were the two that I think that they've been honing on the most. I'm trying to think. I know I got paid for the Invisalign one because we had to miss work, but the other one is on the weekend, so I didn't get paid for the implant one. But I mean, it's also your own knowledge and it helps you be a better clinician. So it's your benefit too, you know? But the other ones were at convenient times, like in the afternoons. So I didn't have to miss work or anything like that. But if you do end up having to miss work, most of the time I think they cover it. But I don't know because I haven't done that many.
What I'll say to that is, even in your first year with us, you have the ability to have, I think, up to 100 CE hours just from the programs that we have available to the doctors, from the implant continuum to the ortho, so Invisalign. And then there's other CE that's made available to you through webinars and that we have that's ongoing. We have a robust CE database online as well. We've got partnership with Dr. Bicuspid, which I'm sure many of you know Dr. Bicuspid. And so that gives you access to all of the CE that's within that network, aside from what we already organized for the doctors, because again, we've got great partnerships with our vendors. And so whatever CE that they have available, oftentimes they make it available to us and it comes at no cost to our doctors. So I want to say that most of our CE that's provided within Aspen, with the exception of like surgical placement of implants, which even that, the cost of it is a fraction of the cost of what it would cost if you were in traditional private practice. You get such a savings with that course, and it's hands-on. Before we used to fly the doctors to Mexico, but now with COVID, we're trying to re-engineer that, and we're looking at a program in Alabama and some other places, but that's available to the doctors. Everything else is complimentary, really. Unless something comes up along the way where it's a cost to a doctor, it's literally going to be like cents, like it's $5. But most of the courses that are Aspen that are available to the Aspen doctors are going to be complimentary to you. So the implant continuum part 1 and part 2, where you're learning how to restore implants, learning how to gain confidence, how to present it, that's free. And that starts on day 3 of being in our organization. Ortho, Invisalign, lift training, where you have to spend thousands of dollars for that, is free to you. So you don't have to go anywhere seeking it out because it's already made available to you. The key to it is you've got to reach out. You've got to just take advantage of it, knowing that it's there. And we have tools to help you navigate. We've got a network called like Blueprint Learning, where it's a learning management system. So as a doctor, every doctor has access to it. They have their own account, and there are all these CE courses that now you have readily available to you. We've got Vivint Learning as well, and that's through a lot of our vendor partners. So that's readily available. With COVID right now, with the pandemic, a lot of these courses are going to be webinar, they're going to be virtual based until we can get to a point, and we're hoping it's sooner rather than later, where we can now host programs and these CE courses in Chicago or in Syracuse or wherever we have our practice support centers, which we have 4, 2 in Syracuse, 1 in Chicago, and 1 in Arizona. So that's the idea. And just to kind of plant a seed too, so you're aware of how much this organization is growing and what the focus is on with regards to doctors and their development and making sure that they're getting top of the line education and support, is come next year around September 2021, we're going to be hopefully moving into our opening up our newest learning and development center. And what we plan to have is this state-of-the-art, world-class training facility where we can do implant training there. We can do endo, oral surgery, every aspect. And we've got to go through the regulations and work through, state guidelines and stuff like that. And we're working through that right now. But it's so exciting because this is going to be 300,000 square feet, 18 levels, and it's even going to have an Aspen office in it. And all of these training facilities and, again, state-of-the-art technology. So it's really cool to see how this company has evolved and what opportunities they have available for the doctors. So I know that was a long-winded answer for CE, but I also wanted to plant the seed for what's coming in the future.
Yeah, no, and that you explained it perfectly. The only thing I'll add is due to COVID, there is a benefit to everybody. We've opened up our CE library to everybody until the end of the year. So if you want to go check it out, you just have to register. You can go through the courses. They're all virtual right now. aspendentalce.com, and you can view our library and get a taste of what all there is to offer, and that's available to everybody right now due to COVID. So. Okay, last question for Dr. Knowlton. Do you have a patient story you want to share with us? Because I love hearing these. If you have a patient that sticks in your head or a case that you've done.
The short answer is every day there's a new patient story. That's my short. Every day I have a patient that just touches my heart somehow, some way, that I just go to bed thinking about, go to bed wondering if they're okay. Different reasons for each one. One of the ones, a few of them recently, one of them was one that worked at Disney. I was worried about whether they got laid off at Disney. And, she came in she had a dentist that she had been going to for 20 years. And he was retiring and got a new associate, and she just did not like the new associate. So she decided to try us for a little while, and she needed some work done, and we connected, and she started telling me about how she's waiting to hear back from Disney as to whether she's going to keep her job or not. And it doesn't have a happy ending, unfortunately. But, now her husband and her daughter are going there, and she's now doing real estate. So she's doing well. So that was one that really stuck in my head. Little things I love connecting with people on another level than just dentistry all the time. So I'm constantly talking to people about what they do outside of, coming to visit. I have another patient who works at Ford, and I was telling her that I want a new Ford card that's coming out. It's called the Mach-E. I don't know if anyone's heard of it, but I'm really excited. It's an electric car vehicle that's awesome. And she's like, I'm going to come up here and I'm going to drive you in it. You wait and see. Next checkup, I'm going to bring it for you. And I'm so excited to see her again. And just little things like that I get to share with my patients. When I started with Aspen, sorry if this is going to be long-winded too, but when I started with Aspen, one of the things that Dr. kind of interviewed me with, he's like, we do a lot of dentures here. And I was like, oh, dentures, dentures are so not fun. I've done dentures, but I've gotten to do those things that you see in those videos of what you want to be when you grow up as a dentist. I've gotten to change people's smiles. I've seen people cry in my chair, not only delivering dentures, but also delivering, I fell and I broke my front teeth, and fixing that, to people who are just, we have them. You have those tears at least once a week at Aspen Dental, because they are so available, because they are so affordable, because they are so well at marketing. People come with those kinds of situations. You're not finding those people who only go to like the fancy malls, who only want full mouth. No, you're finding real people with real problems, real stories, that haven't had a chance to do their moment, and this is their moment to finally spend some time on themselves, and they're there for your help. And you get to do what so many people say that you can't do if you're not in private practice, which is change someone's life at an affordable price. And I do it all the time, and we don't have less quality stuff. We're still using amazing labs. Just because they're not paying $1 million for it doesn't mean it's not. I know as a dentist that I'm putting my 100% good quality work on the things that I am doing. So I know that they are getting the $1 million price tag for much less. And I get to feel the benefit of having helped someone who maybe wouldn't have been able to ever have that, that situation before. And you think to yourself, oh, since it's Aspen, they're not going to accept, implants and this, that, and they don't. They do. You have people, the lay people that come in every day, who work at Walmart. We have people who work at Walmart who on their days off come in to get their dentures done. And then I'm like, you know what? If you want to chew corn, if you want to have a rib, you're going to benefit from getting implants. And they're like, you know what, doc, let's do it. Let's get some implants in. And even if they say they can't afford it, you tell them, you know what, that's okay. Right now you can't afford implants. Why don't we just work towards saving up a little bit, working with you to get you there so that you can one day enjoy that corn on the cob again. So in Aspen, I think you will never just have one story. You will always have multiple stories because you're going to affect people's lives every single day and very surprising ways. And you're going to have fun doing it at the same time because you're going to meet great people. So
that's a perfect answer. I love that. That's why I ask it. And we'll end the night with a question I usually ask both doctors, but we're running late. So I want to give the floor to our Director of Clinical Support. Any lasting words that you have for these D4 students on, finishing out their school year, or just any closing statements, anything you want to go over that we didn't go over tonight?
I think that, right now there's going to be so much that you're thinking about, so many questions that you're going to have. And so while we have this AMA, and I'm so happy that you all were able to join us tonight, and I saw the number of people that were here and still hanging on, and I know it's been a long day, probably a long day of clinic. You've just been in the hustle and bustle. But know this, whatever questions that you do have, you can always reach out to any one of us. We're always available. I know that for myself, and I feel the same. I feel the same from Dr. Knowlton too, that we're a resource. I always tell doctors, I'm a dental guardian angel. So whether you need encouragement, advice, some uplifting, or just some guidance, I'm here for you. I got your back. Whether you decide you're going to join Aspen or not, there's no judgment at all, because we're all in this together. As cliche as it sounds, we're in a phenomenal industry. I've been fortunate and blessed to be, 11, almost 12 years strong now in this industry, and I've seen a lot. So the other piece too that I would say is, listen to your heart. Listen to your heart, because again, you're going to have to make some very life-changing decisions here shortly. And some of you are already facing that. Maybe some will want to go into specialty, some will want to go into residency, and then some will want to just say, you know what, I'm ready to go out into the real world. So, figure out what it is that you really want to do, who you want to be as a clinician. And then when you're going out to seek this opportunity, make sure that you're asking the right questions, you're getting that guidance. You've got Dr. Knowlton, that's a fellow alumna, that you can connect with, that she can share her experiences and things like that, so that you're making the best informed decision about your career. And that's going to be key, because that first job that you have is really going to set the precedent for the rest of your career. So you want to make sure that whatever you decide, if it is going to be a job, is that you're getting the most and the best out of it, and you're finding that place where you feel like you're going to be able to excel as a clinician and as a leader, and continue to grow and propel your career.
Awesome. Well, I will be sending out an email to all you guys who attended, where you can rewatch this if you guys want to cue in on certain parts. If you want contact information for either of the doctors we had tonight, I'd be happy to provide that. Just reach out to me. But again, thank you for attending. And Dr. Knowlton, Dr. Imodumwani, I enjoyed getting to know you guys today, okay?
Thank you so much for putting this together. And thank you all again. Have a wonderful evening. Be safe.
bye. Thank you.
Have a good night, everybody.
Ciao.